want to just start off just saying good morning to everyone. We'd like to welcome you again to a Town Hall Digital Conference featuring Senator Dick Durbin and Representative LaShawn Ford. This event is presented by the Africa Global Chamber of Commerce and my company, WDB Marketing. Excited to present this event at this time. I am Keeana Barber, the CEO at WDB Marketing, and my company and the Africa Global Chamber decided to partner because we know what's going on right now. We're in a global pandemic, and the Black community has been disproportionately affected by this. And because we both work with thousands of business owners, we thought this was the time to talk about not just what's going on, but about solutions. So what can be done at this time? I want to make sure that people know that please stay engaged, post your comments and your questions so we can ask those to our speakers as we talk, because this conversation is about COVID-19, but it's also bigger than COVID-19. These disparities existed in our communities for far too long. Business and health disparities. Our businesses have lacked access to capital. We've had a lack of health coverage and insurance and preventative healthcare measures. So the conversation today is about, we will talk about some of the resources and opportunities that's coming because of COVID-19, but we'll also talk about long-term policy. So what policy can we put in place to make sure that these disparities don't continue to happen? And I'm excited to have this conversation with an all-star group of people. So we made sure that we brought the people to the table who could actually make an impact, who are part of the solution already, and who are very involved in different sectors of the business. So I want to briefly just introduce who you'll be hearing from today. So you'll be hearing from, of course, Senator Dick Durbin. You'll also be hearing from State Representative LaShawn Ford. We have the chairman of the Africa Global Chamber of Commerce, Olivier Kamanzi, who will be opening up after me. We have Dr. Jeffrey Sterling, the CEO of SIMCO, which is a national healthcare initiative. Janice Henry, who's the chairman of the Health Committee for the NAACP. Ms. Vicki Brown, who's the director of the Small Business Development Center, Southland at SSEGI. And finally, we brought one of the funders to the table, so people who will have access to giving the businesses money, Mr. Maurice Williams, who's the Vice President of Economic Development for the Chicago Community Loan Fund. So what we did was, again, tap into our resources to bring the right people to the table to really talk about what's going on right now and solutions for what's going on. One thing I do want to highlight as we get started, I'm sure many are following the relief efforts. So the Senate just passed a $484 billion relief effort. So we'll specifically be talking about what that money will possibly be used for today. Out of that $1 billion relief effort, it hasn't passed the House yet. $310 billion will be used for the Paychecks Protection Program. So that's the money that's supposed to specifically go to small businesses. So we want to talk today about making sure that that money is earmarked and allocated for small businesses, specifically Black businesses. $60 billion will go to CDFI, so the smaller lending institutions that already have more existing relationships with entrepreneurs. And finally, $60 billion will be going to the economic injury loan program, which is a forgivable loan. So we want to talk about access, what's actually coming down the pipeline right now, and how our businesses can immediately begin to access this money. So with that being said, I'm very excited to start this conversation, and I will turn it over to the chairman of the Africa Global Chamber of Commerce, Mr. Olivier Kamanzi, who will open us up.
Thank you, Keeana. Thank you so much for these wonderful introductions. Also setting up the stage so that everyone can understand what we are talking about.
Yes.
Once again, good morning, everyone. Good evening, good night, depending on where you are as you are being followed around the world. We are live on Facebook, on YouTube. So wherever you are, in your homes, you are locked down. Once again, my name is Olivier Kamanzi, Chairman of Africa Global Chamber of Commerce, also Chairman of Africa Diaspora 6 Region, Illinois chapter. I'm also an entrepreneur. On behalf of Africa Global Chamber of Commerce leadership, let me start by sending our message for compassion, solidarity with the people around the country and globally who are being affected by COVID-19. Those people who lost their loved ones, can't afford to pay the bills, put food on the table because they lost their jobs or their businesses have been shut down. So welcome to this first time Town Hall Digital Webinar Conference with Senator Dick Durbin as our keynote speaker, State Representative LaShawn Ford, and all distinguished panelists, Janice Hanley, Dr. Sterling, Vicki Brown, Maurice Williams, and many more who will be joining us. I would like to take this time to thank NAACP, Rainbow Push, and the other business people who have been meeting daily, day in and day out to discuss about how to empower our community, especially to discuss about additional funding, since we have most of our businesses did not get chance to access to these PPP loan program. So I think this is the right time to discuss about that. I would like to thank Senator Durbin. Thank you so much for accepting to be here today. As always you do, every time we call you up, every time our community calls you, you show up. You have shown your leadership to people of Illinois, our country, and the global community. I would also like to thank Rep. Ford for your dedication to empower our business community, the people for Illinois, your tireless work. Thank you again for what you are doing to our community. I thank all our panelists for really coming from various backgrounds to come here to discuss about those who are practitioners. We have people who are RNs, who are in the field right now, who are doing such amazing work to save lives of people. We invite them, we invite the people in charge of CDFI, those who are in microfinance, to come to discuss how this money don't go to big banks, rather go to people who are in need as well. So we invited to various people from various backgrounds to come here to have a conversation. As you might know, Africa Global Chamber of Commerce is based here in Chicago, is a not-for-profit organization whose mission is to promote trade, investments, cultural exchanges, and education for the African economic interest, also a global community as well, starting from the United States. Locally, we strive to build and to empower our business community, also including professionals as well. We partner with various organizations, government agencies around the world. We make sure we fulfill our vision, which is to empower and bring people together, our Black community, our Black business community, and empower our people in our community. Today, we are here to talk about solutions. The purpose of this town hall is really to discuss, to open discussions and identify solutions related to this economy, what's going on right now. As you know, many people are predicting the recession, economic recession. We want also to hear our panelists discuss about how this new program is going to arrive in our community. Thank you, Senator Dick Durbin, to be with us. Thank you so much for being here this morning. I don't know if I have to really to introduce him because everybody knows you, because your work, what you do, speak, your actions, everything you do speak themselves. As you know, Dick Durbin is a US Senator from the state of Illinois. He has been engaged in what's going on, especially this protection program, this PPP loan program and the other bills here, not only here in the Congress, also here in the state of Illinois. He comes and he tells us what's going on in Congress. So we are really blessed to have you here this morning to give us what's going on, and also we will open up the questions. People will be here to ask you questions. Without any further ado, Here is Senator Dick Durbin. Welcome.
Chairman Kamanzi, thank you so much for the kind words, and it's an honor to be with you and those who are participating this morning. I am developing a new expertise over the last month, an expertise in what we call conference calls, telephone conference calls. I spend most of my day and most of my waking hours on conference calls, listening, speaking, and I'm happy to join you this morning. A word of advice that I always give at the beginning, the best way to hear me is to make sure I can't hear you at this moment. So please press the mute button on your phone until I finish speaking, and then I'm anxious to hear your comments and questions. So look for the mute button. Now's the time to press the button. And let me just give brief remarks because they've already been highlighted by way of introduction. We are facing this national health emergency, this public health crisis, this coronavirus, which started halfway around the world, traveled in a matter of days to the United States, and now, frankly, envelops the world. 2 million cases of coronavirus worldwide, 140,000 deaths so far. I haven't seen the latest figures in the United States, but it's over 30,000 who've died, and we anticipate, sadly, even more. We've had 600,000 cases, 25,000 right here in the state of Illinois, primarily in the Chicagoland area. 35,000 rather, Americans or more have died. Here's something we've learned. We weren't surprised, I'm sorry to say, but we've learned that there are gross disparities in healthcare in America. And when you look at the simple numbers in the state of Illinois, where we are keeping track of this information, where we are collecting the data, asking the questions, writing down the results, here's what we find. Black Illinoisans make up 15% of the state's overall population, 15%. They account for 40% of all coronavirus deaths. An African American in Illinois is 3 times more likely than a white American to die from coronavirus. The situation in Chicago, troubling. Black residents account for 60% of the population of, 60% of the total coronavirus deaths, despite comprising only 30% of the city's population. These disparities are not new, but they reflect the reality of where we are when it comes to healthcare in America. We've talked about this from a number of different perspectives. For several years now, 2 years now, I have worked with the major hospitals in Chicago on something known as the HEAL Initiative, H-E-A-L, HEAL Initiative. We have engaged the 10 largest hospitals, and we have asked them to look beyond the walls of their magnificent buildings to the neighborhoods surrounding their hospitals, and to embrace these neighborhoods, to reach out and find out how many people in their neighborhoods are working at their hospitals, how many businesses in their neighborhood are supplying their hospitals, and equally, if not more important, what is the public health situation in the neighborhoods around the biggest hospitals? And we've seen a revelation. Not enough people are working, not enough businesses are located, and sadly, the public health numbers and the shadows of the hospital are very disappointing. But these hospitals stepped up and over 2 years have engaged in this HEAL Initiative. When this crisis has passed, there will still be a demand and a need for this type of public health initiative. Mayor Lightfoot has been to several meetings with the hospital administrators on this HEAL Initiative. She understands it. Toni Preckwinkle, the president of the Cook County Board, she comes, she's part of it, she understands it. There are many aspects to it. First off is the fact that many of the people in the African American community have comorbidity or other issues that they bring to the hospital with their COVID-19. They include asthma, heart disease, hypertension, blood pressure, all across the board, diabetes, and these end up complicating the situation, the healthcare situation. So if we do not treat these chronic health challenges in America, and particularly in the Black community, we cannot be surprised that the health outcomes are disappointing. We have to have an ongoing commitment to these health problems. Where does it start? It starts at home with people understanding their health situation and doing something about it. It starts in school, where children are educated about good health, good nutrition, how to keep yourself healthy, and how to detect things that may need to be reported to your family, to a nurse, to a doctor. It also goes beyond that. The churches in Chicago are an important part of delivering the message to the people who attend them on a regular basis. Many of them have a clinic. Many of them have healthcare counselors who meet with the people in the churches and talk to them about the appropriate way to deal with these health issues. So we've got to make sure that the bottom line is we're sensitive to why more Black Americans are dying from COVID-19 than white Americans proportionately. We've got to also commit ourselves to Obamacare. I say that word with pride, one of the most important votes that I ever cast in the Senate, which set out to make sure everyone had access to affordable, quality health insurance. We've been battling for 3 years against this president who wants to do away with it. If now more than ever, we understand why health insurance is so important. Let me also say that we're working to make sure we collect this data across the United States that we're collecting in Chicago and Cook County, so we can measure and better understand the racial disparities in our country and build up, I hope, a force for change in Washington, which I'd like to be part of. The second thing I want to talk about is the economic impact of this coronavirus, which was mentioned at the outset. It was a miracle, a flat-out miracle. Almost 4 weeks ago, on the floor of the United States Senate, 4 weeks ago, we passed the biggest rescue bill in the history of the United States. Listen to this number, $2.2 trillion, $2.2 trillion. It's a long line of zeros, but $2.2 trillion is the equivalent of the total federal budget for the United States of America for domestic discretionary spending in 1 year. We did it in one bill. We did it in 8 days, and we passed it 96-0. No one voted against it. Why? We realized that the American economy is on the ropes. Businesses have closed. You've seen it. You walk past all those closed doors and closed signs hanging on the doors, and those business people who were making their lives in those shops have nowhere to turn. And so we passed this bill. Two things that really drove the bill. First, if you lose your job, if you are unemployed, we want to make sure that unemployment insurance is there for you. So anyone who has been laid off or terminated can contact the Illinois Department of Employment Security, which handles unemployment insurance, and qualify for state unemployment insurance. And if they do, they will get a boost of $600 a week in the payments from the federal government for the next 4 months. That is what we've committed to. Now you say to yourself, wait a minute, I run a barber shop. I'm self-employed. I'm never going to get unemployment. Don't say that. Go to the department. We expanded the categories of people who are eligible for unemployment insurance, the $600 a month at the federal level. We extended the period of time it will cover. But this is our way to say to people, if you lost your job, we want to send you enough money to get by. You won't get rich, but you'll get by until this economy gets back on its feet. So that's number one. Number two is even bigger. We've said if you are a small business owner with fewer than 500 employees, fewer than 500, you can borrow money from the federal government. How much can you borrow? Up to $10 million. How do we calculate it? You take your monthly payroll, multiply it times 2.5, 2.5, and that's the amount that you can borrow. And then what happens? If you take the money and turn around and spend it to keep paying your employees, to keep paying their benefits, to pay your utility bills of your business, even if it's not running, and to pay your rent or interest on your mortgage, if you spend it on that, you do not have to pay the money back. You do not have to pay the money back. And there are grant programs as well, not just loans, but grant programs. The loan can be forgiven if you spend it on the right things. The grants, of course, don't have to be repaid either. That program has been so popular that we went through $350 billion across the United States in about 2 weeks and a half. And yesterday, the Senate passed a dramatic increase in the amount of money for this program. Now, I've got to tell you, it's been mentioned here, but we learned something in the process. Guess what? Some of the banks didn't handle it the way I think they should have. They took their best customers, who frankly might not be in very serious trouble, and they said, well, you'll be the first in line to get these loans. So they took care of their best customers, and the small businesses, the ones that may not have that big relationship with the bank, that may not even have used a major bank in the past, they're left standing by the curb. So we came back yesterday in the bill we passed in the Senate and said $60 billion of this is going to be used for loans to those types of businesses, minority-owned businesses, for example, businesses in the inner city of Chicago, small town, rural businesses downstate. So we've got a special provision in there that you can turn to a community bank, a credit union, a community development finance institution, and they can help you apply for this SBA loan that we've set aside money for you. I think many minority businesses got the cold shoulder right away from the big banks, and now we're giving them a second chance with more money. We're going to spend all this money in a hurry, and we'll be back for even more, I'm sure. But I want to make sure whenever we do, we always make it available for people who aren't the friends of the biggest bankers in this country, but still need a helping hand. Getting these small businesses reopened and back on their feet is a major responsibility we all share. I'm going to close by saying this. Governor J.B. Pritzker, Mayor Lori Lightfoot, and so many others have shown exceptional leadership in this health crisis. They are saying things that aren't always popular. You know, we don't like to be stuck in our homes. We want to get out. We want to have fun. We want to see our friends, but it's not safe. And they're telling us, reminding us every day to be very, very careful. We're also trying to help our hospitals stay open, especially those that are struggling. Some of you know Roseland Hospital. Roseland is, it's an amazing story. Tim Egan runs the hospital. I don't know how the man keeps the lights on, keeps the doors open, but he is constantly trying to find ways to serve the African-American community and the Hispanic community, which have no place to turn. So whether it's Stroger Hospital or Roseland Hospital, I could go through the long list of great hospitals in Chicago, but we are sending billions of dollars to these hospitals so that they can do their job and keep us healthy. Let me close by saying it's an honor, and I'm going to open it to questions. And that means if anybody has a question, that they can go ahead and press the mute button, open it up, and I'll let the chairman take it away if he wishes to manage this part of the program. It's an honor to be with you.
Thank you, Senator. Thank you for this wonderful message, especially bringing us the current situation of the current, the new bill. Really in support of our small businesses, because we have been discussing about the big banks and really are not really happy about small businesses. So we really appreciate the work we've done to make sure we are being taken care of. We hope this money will come to our community banks, credit unions, as you mentioned, to be able to really to access to those funding. So, and I would like to bring Keeana. I think we have a few questions. Keeana would have 2 questions. I would have 2 questions, and then we open up to our audience with questions. So many people have posted the questions. Right now, we have over more than 130 people on the participants. We are the people who are really listening to us, who are following us, who really feel free to post your questions. We're happy to bring those questions to the Senator. If not, we will forward the question to his office, and then they will get back to us with responses. Keeana, please go ahead.
Yeah, so yeah, thank you, Olivier, and thank you, Senator Durbin, for that. You actually answered one of my questions when I got a chance to dive into the money that's coming down. I did see that $60 billion specifically have been allocated for the smaller banks and CDFIs. But my question is about how do we enforce this? I have 2 questions. how do we enforce the banks to make sure that they're following the proper protocol to give access to these smaller businesses?
You know, that has really been frustrating. I want to tell you, we have tried all the way through this thing to require these banks to disclose those that they're loaning money to and those that they're not loaning money to. I want to know the circumstances here. We're going to learn a lot when we're going to find this out. It's going to take some time. We're going to find it out. But every time we keep saying we want full transparency in the bill, the other side of the table says, no way, we're just not going to let you do that. The day's going to come, mark my words, I hope sooner rather than later. We're going to find this out. And some of it is going to be heartbreaking and some of it is going to infuriate us. But I believe now, and the reason we put this provision, sadly, these big banks are taking care of their best customers first. They may not be the most deserving people. They may not even be harmed by this whole thing. And we're going to find that out later on.
So there's no way for them to be penalized or anything because they're getting the money from the government. And again, like you said, you know, we represent, you know, so many small businesses, and most of them, like you said, they got locked out. We heard the Roof Chris, you know, and the Potbellies, they got 10 million and 20 million. So that just, you know, is shorting the pot so much for us. So just trying to figure out when this next round of funding goes out that we can ensure that it is going to small businesses. And my second question was more long-term. So I think that, again, COVID-19 just amplified what is already going on in our communities. So we know that Black businesses specifically have problems getting access to funding. I've been in business for 15 years and got turned down by several traditional lenders when I was trying to buy my building. What kind of policy can we put in place that prevents this going forward?
You know, this is not a new problem. I'm sorry. You know it better than I do. This has been going on forever. African-American, minority-owned businesses, as a general category, always have more battles to fight than other businesses. It's not just a question of whether you have a good business idea and a good work ethic and a good product and a good service. It's a question about whether or not somebody believes in you. And if you're facing a banker across the desk who just doesn't believe in you, it's hard as heck to get started. And many of these businesses fail because they're not adequately capitalized. They can't see it through a bad week or a bad month or a couple bad months. So, you know, I'll just have to lay the cards on the table. We're going to need a president who cares about this issue, who can open up opportunities for money to be lent to help these businesses. We don't have it at the current time.
Okay. I think Dr. Sterling had a question specifically about healthcare.
Okay.
Greetings, Senator. Thank you for your listener support. I've been having this conversation at the national level as well as on the state level. In fact, I have a meeting with the Lieutenant Governor this afternoon on the topic, as well as County President Freckwinkel. So I wanted to get your thoughts on this. You know, the United States is acknowledged to have the best medical centers and medical care in the world, but we don't have the best public health infrastructure. As you pointed out, the safety net has been exposed as a patchwork system that really needs to undergo a fundamental transformation. So much of what people talk about, they talk about healthcare in the United States, has to do with the medical care, the curative care. There really isn't much conversation that has ever gone on about health promotion and health prevention. We're trying to get an infrastructure set up in the state of Illinois where the people can become empowered. After all, people only see their physicians once a year. There's a tremendous burden for individuals. There should be a tremendous burden for individuals to be better stewards of their own health care and to have the government, as it can, help to eradicate some of the social determinants of health. Can you give your thoughts on that part of the conversation, health promotion and health prevention, and how we can change the paradigm to have the government support those types of initiatives in the same way that money constantly flows into the curative side of care?
Well, there's so many pieces to that. It is a critically important issue. You know, food deserts are an example of people who, through no fault of their own, live in a neighborhood where all you got is a corner grocery and frankly, not very much by way of fruits and vegetables and things that we all need to stay healthy. Secondly, you've got folks that really have never been taught. They've never learned. I go to a high school not too far from where you're sitting right now. A couple of years ago, and I asked the principal, I said, what do these kids eat for breakfast on the way into school? She says they eat Flaming Hots, which is some kind of a chip with spicy pepper on it, and they drink orange pop soda. That's breakfast. I said, that's breakfast? What's going on here? I walked through the school cafeteria. Well, what are you serving in the cafeteria? Well, today we're serving pizza and corn dogs and tater tots. That's it. That's it. And you think to yourself, now these kids are being raised to believe that is food. That is what you eat every day. Is it any wonder that they're not healthy? I mean, the human body is very resilient, but you got to feed it some fuel so that you can produce energy and good thinking. And we just don't do enough of that. Nutrition to me is the critical first step in a conversation about good health. Secondly, there are bad habits people get into, whether it's smoking, using drugs, which you shouldn't be using, or, doing things that frankly just harm your body over a lot. Vaping, this whole vaping thing that's a rage now in middle schools and high schools across the country. We've got to speak up and lead on these things, and we've got to help educate. And I go back to the church community. It's such a great anchor in the city of Chicago. Church leaders, I think many of them understand this, and they're willing after the service to have some opportunities to educate the people in the pews and pulpits. And then we need to make sure that there's good health care available. God bless the clinics across the city of Chicago and state of Illinois. They are opening their doors to people, whether you have insurance or not, to give them some of the best quality health care you can imagine. I'm all for these clinics. I'm going to keep pushing for these clinics and more health insurance so people can get the kind of help they need early on so we can cure problems rather than see them get worse.
Senator, as you mentioned, the COVID-19 economic vulnerability translated into poor health outcome in our community. Do you see any community interventions you could propose so we can work with your office really to solve this problem of poor schools in our community and not having good jobs or successful businesses? So that really we can end this pandemic poverty going on in our community. What can we do to work with you to make sure we address those issues?
We're going to see this economy get back on its feet. It's going to take a while, but there are going to be some new jobs out there. We need people to work in the field of healthcare who may not have thought of that before. But if we're going to manage this crisis for the next year until we get a vaccine, we're going to need healthcare workers to be reaching out to people. For example, if you've been exposed to a person who's positive for this COVID-19, you need to be tested. And we're going to need health workers who can bring these instantaneous tests that take just a minute or two to get you a result. So there'll be some job opportunities there. And I hope it might entice people to get into the healthcare field. We need mental health professionals. I haven't mentioned that, but that is definitely an issue. This high school I mentioned to you earlier has a clinic. The high school has a clinic. And I asked the nurse at the clinic, so what do these high school kids come in and ask you for help with? And it turns out more than half of them, it's for mental health counseling. They're going through a lot of problems in their minds, and they need to talk to somebody. So mental health counselors are an important part. Caregivers. Think about how many caregivers you need in your life. You're married, you got a new baby on the way, you better make sure you got some daycare. You send them over to Head Start. You want to make sure that the men and women who are working in Head Start are not only good teachers, but also understand how to raise children. You have a disabled person, caregiver. You have an elderly person, caregiver. You have a veteran who's disabled, caregiver. We need to make sure caregivers are respected for the important work they do. And sadly, now we don't do enough of that.
So, Senator, This is Maurice Williams from the Chicago Community Loan Fund. First, thank you for your years of service at that level.
Maurice, we were just talking about you this morning. I was saying to Clarisol Duque, who's my chief of staff, I said, now who was it that we worked with on this CDFI? And they mentioned your name, so it's great that you're on the call. Thank you for joining.
Awesome. Yeah, it's good to reconnect in this way, but I think that we appreciate the long-term service, but particularly your leadership during this time at the Senate level. I think what struck a chord with me is that from a lending standpoint, it is all about relationships. But you need more critical, deep relationships when there's times of trouble. And CDFIs like CCLF and other lenders around Chicagoland, I think can serve a deeper and a better role with providing some of the funds that are coming from the new stimulus bill to make sure that small African-American businesses actually have access to those funds. So we'd like to figure out ways to do that with you more, particularly in Illinois. The other thing that I want to remind the panelists and our listeners is that intermediaries like CCLF are here to stay in terms of building and rebuilding the infrastructure that we're all talking about now, the health infrastructure, the educational infrastructure, the facilities, community facilities, schools, churches. We fund and support all of those areas, commercial retail. So I think that we have an apparatus through CDFIs to really affect some change now during the troubled times, but more so as we work our way out. So we'd love to continue to work with you very closely to make that happen.
I'm counting on you, and I'd like for you to tell me how we best get outreach, how we get into the community and let the small businesses know about this new $60 billion fund and how you can help them fill out their applications for these grants and loans. What's the best way we can do that?
Yes, so I think that we've set up a pop-up PPP program that we did last week, a couple of days, and we had hundreds of subscribers looking for ways to do their application. So we have staff on hand right now who could assist with that. We have partner CDFIs throughout Chicagoland who are ready to join our forces together to help small businesses and people fill out their applications and get technical assistance related to that. You can go to our website right now where we have a full COVID-19 resource directory, if you will. And you can retrieve that and start to pick things out of your own, but you can call us directly and get that information sorted through, and we can walk you through the process. So I think that to answer your question directly, there's a way for borrowers and or business owners to directly contact CCLF, and we can be a conduit to get you in the right place with the right people to get your application in place and then help you track it as it gets into the system. But more importantly, small businesses need help now with getting all their documentation and paperwork in place and actually submitting the application. So CCLF can be assistable with that. We have Chicago Neighborhood Initiatives, LIST, IFF, Axion Chicago. There's several others that we are partnering with right now who can assist firsthand.
That's great. Listen, I'm counting on you, buddy. We held out for 5 days. We would not agree to extending this loan program until we included lenders like yourself that could reach into communities that aren't being served by these big banks. So, man, we're counting on you. And you got to tell us how we can make it better, because there's bound to be another bill coming down the road in the next few days or weeks. So let's do it together.
Absolutely.
Yes, that's why we have people like Maurice on the call, because we know they're a resource that a lot of our businesses are going to need. Senator Durbin, we have a very engaged audience and a lot of questions. I know your time is short, but I do want to get a couple of them in. a lot of people are asking about if they've already applied for funding, but they weren't completely denied. From what I hear, this next round of funding will go to the people who've already applied. First, can you elaborate on the $360 billion and how that will possibly be allocated to people who've already applied but didn't receive any funds?
Well, sometimes, listen, there are a couple reasons why you might not have received funds. One of them is there weren't any funds there. They were all gone. We went through the $350 billion, as I mentioned, in 16 days. So now comes this follow-on appropriation, $370 billion. And what we're trying to do is to pick it up again. So if you're in line, eligible, and they just stopped it because of funds, that's one thing. I assume that you can contact your person that you used to make your first application to see if there was any technical issue. If somebody raised an issue about not enough information, didn't fill out the application properly, got too many employees, whatever it happens to be. I'm assuming the person who made your application can tell you if you ran into a problem there. But this money is going to go fast because the people are standing in line, qualified. I think we'll be back doing this again next week, to be honest with you, and I think we should.
Okay, but the rules are still being written. Would they would have to reapply for those funds again?
I don't think so. I don't think so, unless they've expressly been told they were turned down. If they were told we ran out of money, that's one thing. But if you were turned down, let's assume you're disqualified. You know, SBA has some rules on who can qualify for a loan, and I don't want to get too deep in this because I don't want to mislead people. But if the person, the bank, whatever it was that helped you fill it out, will tell you why you didn't get it. If they say we just ran out of money, there's more money coming. But if there's some other reason, you may have to deal with your application all over again to get it right.
That's correct, Senator. It's very correct.
The last question, Senator, we received so many people on not-for-profit organizations. Those organizations were not qualified for the last PPP loan program, including trade associations and many more. So this time around, how did you include them or not?
No, we did not change the definition, but I want to tell you, if you have a 501c3 tax-exempt organization, charitable organization, you can qualify for these forgivable loans. Yes, you can. And the only thing that stops you is if you have more than 500 people working for you. You're no longer a small business. Then you qualify perhaps for a different kind of loan or grant program. But yes, the program is open. If you are a charitable organization, small group, or a 501c3 type group, yes, you can apply for this loan.
All right, thank you so much. I think we're not going to keep you because time is limit. We have other panelists to talk as well. We really thank you so much for really giving your time to us. We really thank you for the wonderful work you are doing in the Senate. For people of Illinois.
Listen, I need your input. I need your input, and I want each of you who needs help to go first to that bank or financial institution. But if you'd like to call our office, feel free to give us a call. We'll try to help you too. 312-353-5292. Boy, I hope that's right. It's been a long time since I gave that. Hold on, I'm going to look and make sure. I don't want to give you a bad number.
And Senator, I'm sorry, we have one final question from Vicki Brown of the Small Business Development Center.
Okay,
hi,
Vicki.
Senator. Hi, thank you so much for being on the call. We appreciate this. One of the things, not just a question, but when you talked about outreach, we're very pleased to have our Illinois Small Business Development Centers around the state that are able to assist our small businesses. And we've been very instrumental in working with them along with our banking institutions. You are correct in terms of the fact that we have had some challenges with our small businesses being able to access some of those larger banking institutions. Some of them said, we're working with our clients, we understand that. However, if they have one type of business account, some of them were not willing to work with them, even though they had a business account there. They continue to change the rules, change the stipulations, and so we certainly hope that something will change to assist our smaller businesses. We're appreciative of Maurice and the work that they're doing, along with our community banks or smaller banks, which were more than willing to work with our small businesses in the area. But we certainly want to make sure that our small businesses out there know that the Illinois Small Business Development Center is available to assist them and to help them to navigate through this process, along with our other institutions like Maurice. So we're working hand in hand together to try to work through this.
Good. We need people just like you that reach out to these small businesses. You know, some of them, it is a challenge that scares them. They hate it when the government wants another form to be filled out. But this is a matter of survival for many of these businesses. So thank you for all that you're doing.
And I do have a question of clarity, because as we talked about the forgiveness of the loans, if we understand that correctly, it's a portion of the loan that is forgiven. Is that correct?
It can all be forgiven. You could end up not have to pay back a penny if you spend it on the following categories: payroll, benefits, rent, utilities, interest on your mortgage. If you show that you paid all that on the, then you can have the loan forgiven. All of it.
All of it. Okay. And so that is whether it is with the Paycheck Protection Program or with economic injury disaster loan. Either one of those could be forgiven completely. Is that correct?
Certainly the paycheck protection. I won't speak for the other one because I just don't know enough about that one. But when it comes to paycheck protection, yes, the categories I mentioned.
Okay, thank you.
You bet.
Yeah, yeah. So thank you, Senator. We have our
right.
rep of Ford to talk. He had the technical issues, so right now he's online. So,
thank you. Bye-bye.
Thank you so much. Thank you so much. Have a wonderful day.
Okay. So I want to quickly just let people know we do have a format. We're going to actually hear from all of our wonderful panelists today. So the reason we have everybody here is because they answer a piece of this, you know, one of the questions in the pie. So whether CCLF, when it comes to what role the CDFIs will play, some of the technical questions, we do have a lot of great questions we will get to. It will probably be towards the end of the conversation, but we'll answer some of the questions. If you've already applied, can you reapply if people aren't answering the phone? So just bear with us, but we will let the rest of our panelists now get ready to speak. And first, we will have Representative LaShawn Ford, just to give his take on everything and what he's doing right now to advocate on our behalf.
Well, thank you for having me. It's really an honor to be on with the African and Global Chamber of Commerce. It's really what I believe in, fighting for Black people and making sure that we have a strong economy in our neighborhoods and in our families. So we heard a lot from the senator as relates to social services and things like that, which is great to help us get through this crisis. But there is a need for us to be included in the business economy. And that's why I'm very happy to be on this with you all, because I think that we need the chamber to be funded just like other agencies that advocate. We need to make sure that you could get funding to advocate for the business of Black people. And so count me in for that type of support, because you have people in Springfield, you have the county, you have municipalities, and you have Washington, D.C., where all the money right now is being discussed. It would be great if the chamber had access to funds to travel and to lobby. And so we want to empower you. Thank you.
Thank you so much. Okay. So we thank you, Mr. Ford for these wonderful remarks, because many trade associations, Chamber of Commerce are not being funded, as you mentioned. So really appreciate you working with us to make sure we empower our members. So all is about our members. How do we empower members if we're not really funded as anybody else? That's one of questions I asked Senator. So I really appreciate you, the work you're doing. Thank you. So Keeana, I think we can bring the next speaker.
Yeah, the next speaker we have is Dr. Jeffrey Sterling, who's the CEO of Simcoe. So they are talking about preventative health on a national health care, and he's going to give some remarks on what we should be doing now.
Thank you, Keeana. There are 3 points I really want to make. You know, I asked the Senator a question. In case you didn't pick up on it, it's an uncomfortable question because the paradigm of health in the United States is actually qualitatively different than it is around the world. We focus a lot more on treating people when they get sick, whereas others in the world do better at preventing illness. These healthcare disparities that exist have a lot to do with the social determinants of health. And until and unless we learn to do better for ourselves, and again, that's not a criticism, that's a statement of knowing that the government isn't coming to save us, and that as a public health premise, if you wait too long to deal with what ails you, you're going to have worse outcomes. In this world in which we live today, you have to become a better steward of your own healthcare. You have to be empowered, you have to engage your health, you have to prioritize it, we have to change some of the things we do within our means to live healthier lives. Simcoe is an organization that's meant to provide you with that power. We're advocating for you across the city, across the state, to put power, information, and education back into your hands so that you can address, so that our community can address the things that ail us all unto itself. And in the midst of doing that, we want to put in place a long-known public health premise that when you have businesses that are culturally sensitive and culturally specific, when you have healthcare providers and practitioners that are culturally sensitive and culturally specific, providing care and delivering services to those communities, you get better healthcare outcomes. So we're talking about economic empowerment as a means of providing better healthcare access. There's one fact that I want to do in illustrating this. I also had an organization called SI Medical Supply. It's one of the larger medical supply industries in the country. We operate around the world, and we actually have 60 different Black businesses that work under us under the guise of expanding capacity. It's collective economics. In the state of Illinois, there have literally been almost hundreds, as of last week, there were almost hundreds of millions of dollars being spent by the state on PPE, and nothing, literally nothing was being done through Black businesses. These are the types of issues that we have to continue to confront, not just because of the economic empowerment component of this, but because we are able to deliver a more culturally sensitive, specific, and focused set of services to our community. And that level of empowerment is what's going to get it done. With all due respect, keep in mind I'm a physician, I'm an emergency physician, I'm on the front lines as we speak. Waiting until you have the need to be treated. Supporting and enhancing treatment capacity is just part of the conversation until and unless we get involved in health promotion and health prevention, and that is in the hands of our community, we'll never get to where we want to be. So that's the point we continue to drive home.
So how can we collaboratively work together to make sure that, like you said, these issues, that we're getting the proper funding that we need?
Contact me directly. As you know, we already have over 100 businesses up and down every part of the state. We've talked to over a dozen different state legislators and state reps and state senators. As I mentioned, I'm meeting with the Lieutenant Governor today, meeting with County President Preckwinkle. This is a movement that is occurring across the state. We are here to engage in health promotion and empowerment of our communities. This effort is not going to be something that's done from an ivory tower somewhere. We mean to be in the communities, engaging and empowering the communities. Any individual that would ask me that question, get with us directly to see how you can participate in what we call the Simcoe solution. We are very serious about touching the members of our community and moving forward collaboratively as a community toward this specific end. We have to be empowered in order to take responsibility for what's happening to us.
I see Maurice. I wanted to, well, I'm sorry, is Janice still on the line? Olivier?
Janice, are you there? Let me see. Let me check.
If not, I wanted to just kind of have a dialogue with Maurice, because a lot of the questions that we're having from the participants is about the specifics for the PPP program.
Right,
yes.
I know some things because I've applied for it, but I want the expert, of course, to be able to speak on this and address some of those things. So one of the things when we talked about solutions, we wanted to make sure that this funding is going to the House now. So it should be passed within the next couple of days. So I want to make sure that our businesses are ready and in line to get the funding. So if you've applied before, what should you be doing now? Should you be developing that relationship right now with a CDFI? And I also want to break down, because everybody doesn't understand what a CDFI actually is and why you should have a relationship with one. So I wanted you just to dive in a little bit to the program, because a lot of the questions that we have are specifically around this funding, if nonprofits qualify for the funding, and what should be done, because again, we want to leave people with what action they can take right now to make sure that they don't miss this funding.
Yes, solutions. Yes, and so thank you for that. So first of all, CDFIs are community lending intermediaries. So we're here, unlike the large banks, to work with community efforts. So consider us not-for-profit lenders who are community-based, just like lots of other not-for-profit entities, Chamber of Commerce's, community development corporations, housing development, et cetera. So we are on the ground providing lending, technical assistance, and funding so that projects could move forward from a real estate, from a capital, and from a operational standpoint. So just like the Dr. Sterling just said, our services can be an overlay or partner to what he wants to do in the healthcare industry to provide financing, for example, to the real estate of such facilities. But let me come specifically, Keeana, to your question, and that is with the PPP program and the EIDL program, both of those are federal programs through the SBA, as you know. If you have already applied for such programs, you can go back to your same lending institution as long as you did not get denied and reapply during the second round. And yes, you can be a not-for-profit 501c and C3 and do the same. We are suggesting though, because one of the points I want to bring forward today is that since the first round was so oversubscribed, and just as you heard the senator just say, majority of the larger bank customers received the funds first. There's still a whole cadre of people who did not get funded in the first round and who may not necessarily get funded in the second round because both programs are so oversubscribed. So what we're encouraging folk to do is to seek out smaller lending institutions, whether it's credit unions, any group that's FDIC insured, credit unions, it could be a local bank. You may not even have deposits there or relationship there, but you want to go to a smaller bank who then can take in your application and send it on to the SBA. Or there's ways for you to tap into directly. So the PPP program, you have to apply through a bank that's an approved SBA lender. The EIDL program, you apply directly to the SBA. So there's no bank involved there. That's just an online application. It's a 2-page, 3-page application where you put in your financial information. So if you need help walking through any of that, you can call the CCLF directly at 312-788-2497, 312-788-2497. And we have a group of staff, first of all, a CCLF who can help with that, point you in the right direction. But secondly, we also have resource providers through our PPP pop-up initiative and our resource guide that I talked about that could assist you.
Okay, that was great. I want to, a couple people are asking about the EIDL. From when I see the EIDL will get another $60 billion. So I think what they're going to do with the people who are already in line still may be notified. Like myself, we weren't notified yay or nay. So I think, but you can still apply for the EIDL. We will send an email recap to everyone who registered with as many resources as we have. So the direct contact for CCLF, for everybody, and this will also be shared online. Maurice, another question about 1099. So this was a question that I had as well. Does 1099, yes, if you pay your employee, well, they're not technically employees, but you have a subcontractor model, will that be income that you can use for the PPP program?
Yes, to my knowledge, it is, as long as you have less than the legal amounts that they talked about. If you have less than $10 million that you're going for, but you do have a payroll system even under the 1099. So I can get our technical experts to help answer that directly. One thing I did want to clarify from Vicki Brown's question earlier, under the EIDL program, that one is the one that has the emergency $10,000 forgivable grant up front. You can apply for that and just get the $10,000 grant. You're not required to take out a loan. But if you do want to go for a loan, you can go for up to $2 million on the loan side of the house. And, you know, it's 3 3/4% interest for, and they stretch it out over 30 years. So you got different options with EIDL. The PPP program, as long as you're under the $10 million limit, and then you keep the funds ready to pay your payroll, that is a total forgivable situation that you could turn into a grant, if you will, yes, as long as you stay in the parameters.
So 1099, so I heard that for the most part, the 1099's income wasn't acceptable, but I think that again lends to the piece where you should be dealing with a smaller banking institution, a CDFI. I will share, because I've done a lot of research, and we've been applying for these myself for my business. So I'm not an expert, but I can share my experience with things that instead of going to my traditional bank, which is a larger banking institution, I went through my SBA loan program. So by applying through them and having somebody a smaller bank, and it was only a couple of loan officers, we were able to get access to PPP funds. So when you can deal with smaller institutions, they make more exceptions. So that's the one thing, I think the one strategy that everybody should take from this, that deal with the CDFI, deal with these smaller banking institutions, and now is the time. Do not wait for the money to be approved. Make sure you get your applications in now. Make sure you're talking to people now, and make sure, again, you get your paperwork in order. The second thing, and again, we'll share a recap with resources, is the economic injury disaster loan, which Maurice said the first $10,000 is completely forgivable. So those are two different things. So a couple people asked about grants. Most of the grants that I've seen that are out now are only from private institutions like the Verizon Wireless. The Chamber of Commerce is working on a grant right now. Those are the only grants that I've seen. Most of these are in a loan package. So just to clarify, I got my PPP approval just the other day. And they still sent me information on how they would debit my account after everything was over if I did not provide the proper paperwork to say these were the employees that we paid, this was our rent expense. So we want to make sure that we understand that this can still become a loan if you don't have everything in order to show how you use those expenses. So I just want to clarify, because a lot of people are asking about the grant assistance. Everything that I've seen, and Vicki Brown is back on from the SBDC, most of the grant opportunities I've seen have only come from private institutions. And those, again, on a first come, first serve. They're doing a lot of lotteries, but the PPP is a great program. If you have employee expenses, rent expenses, that up to 250% of your 1 month you can have covered. So that means if your employee expenses and your rent expenses, your employee expenses, I'm sorry, are $10,000 a month, you could get a forgivable loan of $25,000.
Right. And there's also, Keeana and Vicki may know this, Cook County is coming out with the Cook County Community Recovery Fund. CCLF will be administering this fund. So this is strictly for suburban county businesses, but here you can apply as what they call a gig worker. And so if at least half of your income comes from 1099 contracts, you can apply for that as long as you have less than $100,000 in gross annual income. And you can apply for up to $20,000 for small businesses and up to $10,000 for gig workers. So you can apply through the county's program. Now I'm told that one will be rolling out by the no later than the end of April. And as soon as it goes live, we will reach back to all of our groups, particularly your group, Vicki, to make sure that people can apply for that, because they are targeting the South suburban region, specifically in the southwest side of the county for these funds. And these are zero interest loans, one-time zero interest loans that could be essentially converted. But that's forthcoming.
And that's correct. Maurice, you were correct on that, but there's an inquiry form that they can fill out right now, which also will have your information already in there when the applications come out. But Maurice, I'd like for you, if you don't mind, would you expound on and just let them know what it means in terms of payroll costs? What's associated with payroll costs? And also, once they receive the PPP loan, what is it that they're going to have to make sure that they keep track of so that that portion of the loan will be forgivable?
Yes. So, and again, you can go to our website at www.cclfchicago.org, and we have a full resource guide that gives descriptions, phone numbers on every program that we're talking about now. It's a great resource too. But when it comes to payroll costs for under PPP, what qualifies you are salary, wages, commissions, and any similar compensation, payment of any cash tips or equivalents, payment for vacation, parental, family, medical, or sick leave. So it's basically all payroll and benefits. For the provisions of healthcare and insurance premiums, retirement benefits, and state and local taxes. So essentially, for your employers that you're paying, your payroll cost includes all payroll plus benefits. And then if you're a sole proprietor, independent contractor, or self-employed under PPP, it's the sum that's on your 1099s is less than 100 grand in 1 year. So that's really what's included in your payroll cost. So it's typical costs that you would incur having employees.
Mm-hmm. I want to follow up with you, Vicki. That was actually one of the questions that we said that we would address today is the Cook County Fund, because that is a loan, but I know it's a 0% interest loan. And we have some people on here that are independent contractors that are asking about funding for them as well. And I know they have money set aside for people who are contract workers as well. So if you can go a little bit more into that fund, and then that fund, like you said, has been announced, but it's yet to launch. So this will be a great time to put your name in a hat for that pool of money.
I think it will be launched this month in April, very soon.
Yes, very soon.
Yes.
Yeah.
Okay. Let's bring Janice Henry from NAACP. She's a healthcare professional. She's an RN. She wants to share with us what's going on the ground. Are you there right now? So.
Can you hear me?
Yes, we can. Go ahead.
Hi. So I'm Janice Henry from the NAACP. And I am also the community health nurse at Loretto Hospital. So I am on the ground every day doing health care, health promotion, and all the things that the Senator and other people have talked about. I'm going to say that that for me, one of my sayings is that Black people are the only flowers expected to bloom without being watered. We have health disparities, and we talked about some of those already today. But I guess what I want to talk about are the numbers that keep coming up about Black people and brown people, especially Black people, and the death rate in Chicago. I would like to know, as a provider, we need more detail on the numbers of people that I know for myself that what I've been doing is we have a lot of people that wanted to be tested, that went to hospitals and to testing sites and were turned away, only to come back a week later or 10 days later and to be tested and to test positive. But you've been in a house with people that were not affected for 10 days. We have a lot of people that are surviving, or that they're saying they're surviving COVID-19, but they're being discharged from hospitals with pneumonia. And so I have a lady that was 102 who survived COVID-19 in her nursing home, who went to the hospital by herself, survived in the hospital by herself, and was released saying that she was clear, only to be released from the hospital with pneumonia and to go back to the nursing home and to die 2 days later from pneumonia. So one of the things that I want to know is, how are those deaths being marked? Are they being marked as COVID deaths or just as pneumonia? Because either way, I believe that the statistics that we're hearing are going to be skewed. So from my perspective, and I'm hearing this from, and I'm seeing this from not only our seniors, but from younger people. They're being turned away. They're going to 3 or 4 places trying to be tested and not being tested. And then when they finally get tested, you have a bacterial infection in your lungs. But you've been in the house with somebody that's not positive for 2 weeks, 3 weeks. So we have to do better testing in our communities. I appreciate Representative Ford for helping to get testing on the west side, but we have to do better with testing. We have to do better with our healthcare providers. Another thing is our seniors. We have to do better with testing our seniors and protecting our seniors and disabled. We have a lot of seniors and disabled people in our communities. And I just believe that this round of COVID-19 was a surprise to all of us. But Dr. Fauci has already said that there's another round coming in the fall around flu season, and that we have to be better prepared. And that does include teaching in the community. It includes all the things that people have said about engaging our churches and other centers to make sure that we get the word out about better hygiene, better nutrition, all of those things. But it also means that we need resources in our community. If we don't have grocery stores, then how do we expect people to eat better or do better? So hopefully this has been a wake-up call for everyone. I don't think any of us ever expected that we would be living through anything like this. So hopefully it's a wake-up call, and it'll mean that we'll get more resources in our community. Another thing we absolutely need to do is we need to do better with our seniors and our young people with technology. People are isolating at home and not able to see or be around their family members. We got to do better with that. The other thing that I'm concerned about is that we have had a lot of conversation about the children that have been affected by it. We just have not had a lot of conversation about it. And these children are away from school, away from being socialized, with parents in a home with parents that are already in good. And we just need to do more mental health research. We need to find a better way to check.
Dennis, can you check your phone, please?
I'm sorry?
Yeah, check your phone, please. Okay, go ahead.
Okay. So like I said, we have to do better with our children too, in terms of their mental health and their stability. So we just need to do more teaching in our communities about what's to come, more teaching in our churches about what's to come. And we need to have, I agree that we need to have healthcare. We need to have more healthcare providers, but we do need to have healthcare providers that are culturally sensitive and have a heart for the people that they are serving.
Dr. Sterling, I know you mentioned a couple people asked more questions. I know you have a statewide healthcare initiative that you have planned that addresses some of these things. So we have a couple of questions specifically to you about the type of businesses that you're looking for to be a part of this. And just a little bit more specifically, how do we address, again, what Janice just talked about, the healthcare disparities that we already knew existed. So how do we create more preventative measures?
Well, the initiative that we're putting forth really is an initiative of empowerment of our community for the betterment of our community. Again, the idea is to transform the habits to where we actually place a higher value on our health, to be more cognizant of it. And that means all hands on deck. Whether you are a community organization such as a church or fraternity or sorority, there's a role for you. We have, like, when I said 100 businesses, I meant that literally. As you know, we have a dozen different legal firms, accounting firms, PR, marketing, and media firms. That's not even including anybody that's inside the healthcare space. We need health educators. We need people that can teach people how to cook. We need people that can help with jobs training. This is basically just make the call. We need people who want to be in business, who want to carve out their niche to join this, because what we're doing is we're taking this forth to our legislators and saying that this is our entire community united, moving forth in an effort to prioritize our community's healthcare. And this is true in every part of the state, because healthcare disparities don't just exist in Chicago. They exist in rural communities. Believe it or not, we all don't live in Chicago. They exist downstate and everywhere else. So what I would suggest to you is that this is also an economic empowerment opportunity. We're talking about empowering over 100 Black businesses to the tune of an average of $1 million a year in contracts. So that means that businesses that are already in existence are doing good, we want to make them great. Those that are struggling, we want to make them good. And those that want to get started, give us a call. We are trying to carve spaces for everyone in this community to organize, to galvanize, and to prioritize healthcare and keep it in the forefront of our minds to the betterment of individuals in our community. So the best thing that I can tell you about that is that we have had multiple forums in every part of the state over the last 6 months. And if you haven't heard about the Simcoe solution, please visit simcoeillinois.com, get up to speed on what it is we're talking about. But more importantly, make the commitment that, hey, this sounds like something I wanted to be a part of, because we're going to hire well over 1,000 people across the state when this comes to fruition. And as I mentioned, we're going to empower about 100 different Black businesses. This is a huge deal. It's meant to be transformative. Just give us a call. It's beyond the scope of what we can say in this setting, but it's coming.
Okay, great.
Okay. Thank you. Vicki, do you want to say something?
Oh, well, absolutely. You know, Dr. Sterling, that just piqued
Yes,
my
go ahead.
That just piqued my interest. I was like, wow, because one of the things that Keeana and I had talked about earlier was certainly we want to talk about post-COVID-19. So we want to talk about, you know, rethinking how we do business and what it is that we do with our businesses. So you just gave additional opportunities for those small businesses, those pre-venture and those that have already started and those that are looking to expand. So I think those are great opportunities to rethink the dynamics of where they want to go and what they want to do and how they can do better, as your sign says before you, in terms of health access and economic empowerment. So in bridging those gaps, I think that's going to be wonderful for our small businesses. So thank you very much. And certainly with Maurice, once again, that's going to be a really good infusion for our small businesses to be able to tap into those additional funding resources. So that's great. I also want to make sure that our folks out there are, as you receive those loans, because we're speaking that, so as you receive whether it's the loans or the forgivable loans, but make sure you keep good paperwork, because in order for those loans to be forgiven, you have to provide that paperwork that shows that you use those dollars for exactly what they require. This is for your working capital. So it's not to start your business, but this is for your working capital. So you want to make sure that you are using those dollars for exactly what they have indicated so that those loans can be forgiven. But thank you very much, and thank you for this opportunity.
That's perfect, Vicki. One last thing, we didn't get a chance for you to elaborate on the county program.
Okay. Yes, we're excited about the county program, and Maurice did talk somewhat about that. And it is geared towards suburban Cook County. And we are appreciative of President Preckwinkle and our commissioners for looking at how we can provide more funding for our small businesses. And one of the things for our small businesses, this is geared for businesses with 25 or less employees. So this is, of course, is going to take, as we've heard, some call it those micro businesses. So this is geared specifically for them, 25 employees or less, and also with less than $3 million in revenue. As we mentioned, this is also for those gig workers. That's a term we haven't really heard before. They haven't really talked about that. So we're excited that they're being thought about, those individuals, those sole proprietors. Here's an opportunity for them to be able to qualify to get the needed assistance for their business. So that, again, is, as Maurice mentioned, is for those that have at least half of their income from 1099s and also less than $100,000 in gross annual income. What this COVID-19 has also done for us is also it's helped us to move our businesses into making sure that we have all of that paperwork that's needed, right? The importance of you having an accountant, the importance of you having those 1099s, the importance of you making sure that you have the proper paperwork. So one of the questions was, what do we do when this next round of funding becomes available? What you can do now is make sure that you have everything in order so that when those applications come out, that you've got everything right there and ready to go. Maurice, would you agree with that?
Totally agree. Totally agree. Yes. Very well said, Vicki.
So Vicki, can you give to our listeners, people who are following, where to get those information? Like this county, the new release fund.
Oh, sure. Absolutely. Well, there's several places that you can go for information. For one, if you're talking about the Cook County Community Recovery Fund, you would go to cookcountyhill.gov and you would be able to get the information. It's cookcountyill.gov/recovery. And so that will provide you the information for the county's recovery fund. If you're looking for further information for the SBA loans, let me tell you, please make sure that you are going to www.sba.gov. That is one of the places that you can find that information. There's so many. We want to also caution you to make sure that you're going to reputable websites, okay, to get that information. So there are some that look for it, so don't be in such a hurry. Make sure you're going to the right one. So www.sba.gov. You can also, when you're going in reference to your payroll or paycheck protection program, the information is typically found on the various bank or funding institutions in terms of what their requirements are. And certainly you can come to our website, which is www.southlandsbdc.com. We are certainly here to assist you, or you may call us at 708-232-3161. So with any of those resources, we are here and available to assist.
Okay, Keeana, I think we need to wrap up these.
Yes, we are a bit over. So I hope everybody, I want to just thank again everybody that came out. We had some people, like I said, who are on the ground floor that can really help. And we talked a little bit, you know, it's a big challenge, but I think the Simcoe solution, Dr. Sterling, you got a lot of people who love that concept, is one of the solutions to long-term, you know, really affecting the health disparities that exist in our communities, and at the same time, empowering our businesses economically. So I'm excited about this. We will make sure we send an email recap that shares the contact information and these resources again with everyone. So everyone who was on the call that wants the information shared, we will recap that. I just want to make sure that everybody leaves again understanding that the EIDL 60 billion will be open back up. So if you have not applied, make sure you get your name in the hat, and time is of the essence. As they say, this is a first come, first serve. So you have to have your ducks in a row. The EIDL doesn't require a lot of information. It's a 2-page application. Get your name and apply. We'll send that out in the recap. The PPP, as they mentioned, get your paperwork. That's the one that requires the payroll paperwork to be in order. So when these applications open back up, but you should be reaching out to the CDFIs and the local banking institutions now. That's who you should be reaching out to. So when the applications open back up, they already know who you are, and your name is already in the hat. So that's some immediate action, and I'm excited. I'm glad that we got a chance to co-host this together, Mr. Olivier. And anything you want to say?
Yes, before we close, maybe we give 30 seconds to each panelist to close this, to say something in conclusion of this. Before that, I have so many people sending us, they want information from a Dr. Sterling. Can you give the listeners, many people are really sending us
$1 million man.
So can you give how people can contact you?
Yeah, sure. You can contact us directly at the Simcoe website. Hit the contact us button at the Simcoe website. You also can contact me directly. I'm not going to be stingy, at sterling@simcoeillinois.com. That's SIMPCO Illinois spelled out .com.
Wonderful. Just closing remarks. Go ahead and continue, and then take 30 seconds to close this.
What I want to tell you guys is that this has less to do with COVID-19. Again, I'm a physician here. This has less to do with COVID-19 than it does the way that we buttress ourselves against disease. As bad as this is, we still are going to die more from high blood pressure, diabetes, cancer, and other things this year and every other year. The long and short of it is, until we become better stewards of our health and worship our health more than we do looking thick or engaging in those spicy Doritos or Cheetos, whatever he was talking about, these types of outcomes are going to happen. This COVID-19 is just a stress, and it is showing the flaws in the way that we care for ourselves, both individually and as a healthcare system. The name of the game is healthcare empowerment, but we're going to teach you how to do it individually, but we're going to galvanize our efforts as a community so that we can get better. and we're going to do it through means that allow us to be economically empowered in the process. So join us, let's make this a revolution, and I promise you we'll get way better than we've done at any point in time in the past.
Vicki, go ahead. Thank you.
Well, thank you. I tell you, it has certainly been a privilege to be here and to be amongst this panel. One of the things that I would like to reiterate, as Dr. Sterling just said, that's being good stewards. And so let's be good stewards over the information that we get. Let's be good stewards over the newfound funding that we get. And then let's continue to work together, because that is going to be the real key for us to work together as a community, for us to, there are not any big I's or little U's, we're all in this together, so let's work together. And also new thoughts, new vision, rethinking, refresh, and revitalize. All right, thanks so much.
Thank you so much. Janice, go ahead. Janice, are you there? You are on the mute.
I think she's off.
Yes, okay.
Yeah. So Maurice.
Yes, thank you for being here. CCLF stands ready to assist and work with any teams out there who are looking for solutions for small businesses, for underrepresented African American and minority communities. I love what the doctor had to say. I love what Vicki had to say. We stand ready to partner with you. Use us as a resource to, one, get access to the existing and the new funding that is coming on board for small businesses. We want to help you in a technical assistance way. We want to help you get all your paperwork in, get you to the right people. Visit our website to get the resource directory, because I think information is power, but once you get that information, you have to do something with it. And we want to assist you with that to make sure that these disparities on the health side don't continue to creep in on the financial side of the lives of Black and brown people. So great to be a part of the discussion, and we are here to serve and be a conduit.
Thank you so much. Janice, are you there?
Yes, can you hear me?
Yes, we can.
Okay. I just wanted to say that COVID-19 has disrupted our lives and changed the world that we live in. A lot of us feel alone, isolated, and confused and full of fear. We can't do anything about the past, but we can certainly change the future. And changing the future means education, it means resources, it means us all working together to make sure that marginalized people have the things that they need.
Wonderful. Thank you, Janice. Thank you so much. Keeana, do you want to close?
Yeah. Well, I mean, I think what everybody said was very powerful. I do agree with Janice. Now is a time we never knew that we would be here, but you have to be able to pivot and you have to be able to, recover from it. So get smart right now, take advantage. I think one of the biggest things that we've all learned about those relationships. So again, we knew that we should be working with more local community partners. We knew that we should be doing better with our health. And this has just amplified that. So I think with a united vision together, and us working together, that we can get this done. But I just want to implore everybody who's on this, who's watching, to make sure that they do take action and don't miss out on the money. Don't wait. We're going to make sure we send out these resources. CCLF has some great resources that they said on their site, and just take action on it. Dr. Sterling, I'm a part of the Simcoe solution, excited to be a part of it. So he is looking for qualified businesses. So that opportunity is there. So you have to be willing and ready to take advantage of the opportunity. So I thank everybody that joined us for this conversation. I thank you, Olivier, for all that you do, supporting businesses here and also globally. I don't know if you want to talk a little bit about the African Chamber as we close out.
All right. Okay. Thank you, Keeana. Keeana and I have been a partner like this. I really appreciate you, the work you're doing in the community, impacting so many people, especially inspiring the young entrepreneurs on the South and the West Side. Thank you for the work you're doing. So we are so glad because Keeana is also part of the chamber. She's a board member. So I want to take this time also to thank my board members who allowed me to really to do the work I love the most, to serve the people. So I want to thank everybody from Dick Durbin to Rep Jeffrey, to everyone. So for really this amazing contribution to you guys, really panelists, you are professionals, the work you're doing is really amazing. I just want to conclude by quoting my hero, Nelson Mandela. He said this: everyone can rise above their circumstances and achieve success if they are dedicated to and passionate about what they do. I think each of us here were passionate on what we are doing. Let's keep it up. So today was about talk solutions. I hope we talked about solutions. This is a beginning. This is a beginning. We are coming together to build our community, our Black community. As you have seen, Keeana, an African American, myself, African immigrant, we came together, we did this. I think each of you, we invite you to join us to continue this movement. This movement, at the end of the day, is to building our communities, as well as to build the Africa we want. Thank you so much.
Thank you. Bye, everybody.
Bye-bye.
Thank you all. Bye-bye.